Hello, health heads. Welcome to this dose of the Healthcare Uprising.
Hi, I'm your host, Heather Pierce. Over the last 20 plus years, I've worked all over the healthcare industry, from startups to Fortune 500 companies, in marketing and communications. Now I'm leveraging my experience and connections in the healthcare realm to bring you this Healthcare Uprising podcast.
And I'm your producer, Jeremy Carr. I have no history in healthcare whatsoever. Your resident man on the street, as it were.
But we're here to inform, educate, and create awareness on all the latest innovations in healthcare, as well as most basic aspects of healthcare, of the healthcare system, like how to use your benefits, what's a PPO versus an HMO, why Medicare matters, things like that.
Yeah, that's what Healthcare Uprising is all about, bringing it to the people. But what's on our specific agenda for today, Heather?
So today we're doing a part two of an interview series with Guava Health, and today is with Dr. Kat McGraw, who became their chief medical officer about a year ago, but has been a medical advisor for them for over 3 years. Guava Health is an app focused on connectivity, health record access, and patient empowerment. Previously, Kat was a hospitalist and chief medical officer at Brattleboro Memorial Hospital and medical director of hospital medicine at Bay State Health. This is all up in Vermont and Massachusetts. She has also helped establish a community health center and a hospitalist program, bringing valuable clinical insight, especially in chronic care management. Her expertise rounds out this two-part interview on how Guava Health is transforming healthcare.
And it really is a Guava Health. It may be the most impressive product we've covered on this podcast so far, at least in my mind. So without further ado, let's get into it with Dr. Kat from Guava.
We have Dr. Kat McGraw from Guava Health with us here today. Welcome to the show, Kat.
Thanks. Really glad to be here.
Great. So just quickly to give all of our listeners a little refresh here. We already had a interview with Isabel Stewart, the head of product at Guava Health. And so she really spoke more to the product piece, kind of the development. She was one of the founders. And now we've got Kat, or Dr. Kat McGraw, who is going to speak from the more clinical perspective about Guava Health. She is their chief medical officer, longtime hospitalist, and CMO of a hospital in Vermont, if I recall correctly.
Mm-hmm. Yeah.
And so,
Nice.
yeah, so we're gonna get really more into, I think, the clinical piece of this, and this will be kind of a part two to our full conversation with Guava Health and learning about all of the really exciting things that you all are doing there. So, with that, Kat, I'd love for you to share a little bit about your background, your experience, what drove you to join Guava. As I know you started as an advisor and now as the chief medical officer, and really just what Guava Health is all about, as well, and what you aim to do with it.
Sure. Happy to. So, I think I'll just start by saying that I first got involved in healthcare because I started a community health center, founded a community health center, and that actually drove me into medicine. And then I founded a hospital medicine program. And then after doing that for about a decade, I became a chief medical officer and chief medical informatics officer for a small independent health system in Vermont. And so I've really seen healthcare from a really wide range of perspectives, and so have a lot of thoughts about the way in which we deliver healthcare, a lot of thoughts about how patients really interact with the medical system and with their own care. And so I have been involved with Guava for about 3.5 years, something like that. I started as an advisor. I'm now the chief medical officer for the organization. And the thing that really grabbed me about it is that right now, the way that healthcare works, you have a medical record with your hospital, wherever you happen to go for the emergency department, and with your primary care provider, and hopefully they're in the same system, but maybe not. And then you have medical records where you used to live and maybe where you went to school, and just this wide range of places where your medical information exists. And frankly, you're not the middle of it in any of those places. You're one of thousands of patients with your hospital system. You're one of thousands of patients for your primary care provider, and you're just not the middle of it. And so Guava is the one way that you are central to your medical information. And our healthcare is so complex. The whole concept that we are not central to our information is just mind-boggling. And so when it became clear to me that this was that Guava was going to be able to work with that and solve that, it was just really exciting. It just provides so many opportunities for ways in working with healthcare. So that's kind of where it started, is that recognition that this allows us to kind of turn healthcare inside out and make us, the patients, be the center of our information.
And coming from the position of being, starting a community health center, the hospitals programs, all these things, it's kind of very clinical perspective and dealing
Hmm.
with people out kind of in the world, right? Like where people
Right.
are that point of care,
Yep.
and seeing all these issues. Did you see Guava Health as just the solution to kind of bringing that all in one place? And you're like, I want to be a part of this because I've got this perspective, and so then you joined as in an advisory role at that point when you
Yeah,
when you when you saw the
absolutely.
light. Yeah.
Absolutely. It's still very early on in the development of it, and it was just so clear the potential that would exist with being able to make folks have all the information really at their fingertips. And then, of course, as I'm sure you know from talking with Isabel, it's not just your medical records, but it's all of the data about you and your health. So it is your wearables, and you're keeping track of things that you actually want to be keeping track of. And so bringing that all into a single platform, as much as we talk about the electronic medical record being a single platform, ha ha ha, that's just from the hospital's perspective. That's not true from a patient perspective.
Yeah, I learned quite a bit about that over the course of my career. It is not it's not I think the big answer that everyone thinks it is. Like, I mean, EMRs are great. That's electronic medical record for those of you who
Thank
Right.
you.
They're
we
not
like
that
to
great.
clarify those. Yeah, they're not, and they're often very disconnected from one system, from one provider. And I know
Hmm.
the
Hmm.
concept of value-based care and accountable care organizations has been part of solving for that. But even then, that's still within the health
Hmm.
system
Yeah,
itself.
I
It's
think
still limited.
patients don't, when I have a patient come to me, so as a hospitalist right now, when I take care of patients, they're acutely ill enough to need to come and be inpatient for their medical care. So those are the patients I'm seeing right now. And they assume that we can see all of their medical records. They assume that we know that they went to the emergency department at the hospital, down the road. They assume that we can take a look at that x-ray, and it's just not true. And that same, my health system might be using Cerner, and that other health system might be using Epic, and there might be a third place that they've gotten their care that's also using Cerner, but it doesn't mean those two Cerner electronic health records are the same at all. They're each an individual version of it, and they don't actually even talk to each other. So accountable care organizations are working at trying to figure out how to warehouse data, but all of it is still really hospital centric, billing and coding centric, overarching population health, analysis centric, and not for the patient.
So with that, this is great setup. So we've identified the problem, right?
Yeah.
We know what's
Yeah.
wrong. We've got an issue with
Right.
access to records, and especially, and this is why we're talking to you today with Guava Health, is those with like long-term, healthcare conditions, chronic healthcare conditions, conditions that have, multiple
Yeah.
providers or
Yeah.
specialists and things like that. And so Guava Health really exists to especially serve those populations. So can you talk about and kind of expand on what exactly Guava Health is doing to solve for this issue of this lack of
Yeah.
connection and this
Yeah.
lack of connectivity and sharing of info?
Sure. Well, so to start with, just to explain, that Guava uses all the different patient portals with different providers to bring all the information into a single place. And then you, as the owner of your Guava record, it is HIPAA compliant, it's secure, but you have the ability to share that information with the provider as you see fit. So that's very helpful because it means that if you, for example, go to see a specialist, you get referred to see a specialist. That specialist may or may not have all the information from your primary care or the labs, the X-rays, the MRI results, all of that, that may or may not be visible to that specialist. And so in this way, Guava can help you bring all that information to that appointment and make that appointment with that specialist much, much more effective. We also have a tool called the pre-visit summary, which allows you to say, oh, I'm going to go see a neurologist for my headache, for example. Let me prepare for that. And it will draw all the information from your Guava account that is relevant, the medications you're taking, the way that you documented what your headache was, whether there was improvement with this treatment, that kind of thing. It will also ask you questions like, what do you think is going on? Because we know, or I know as a physician, that often patients have an inkling about what's going on. And it's important for me to understand that because it's going to help me answer their questions, address their needs, and maybe actually get to that diagnosis much more quickly. It's also the pre-visit summary is also going to ask, what do you want to get out of this appointment? What are you worried about? Those kinds of things. And it puts it all together into a single format that is really digestible for me as the clinician. So that when you come to the appointment for your headache to the neurologist, it has teed up the information that's related to it in a way that lets the neurologist review that and then get to the point of, okay, let's do an exam. Let's figure out what are the next steps with some, already, kind of teed up outcomes that you, the patient, are looking to get. And so it really incorporates that all. It also helps facilitate things like prior authorizations and reducing the need for repeat testing. So let's just imagine that you need to get a blood test. Well, if you've had that done somewhere else, but the provider can't see that, it's not helpful, right? And so
Right.
it's often just as easy for the provider to say, well, let's just repeat this and then we'll have that information. But that's extra expense for you, an extra, trip to the lab. And, it's not best healthcare, but sometimes it's expedient healthcare, really, frankly. But if you have that information, then you don't have to repeat it, right? Also, for things like prior authorizations, which are one of the banes of physicians' existence, it
And
helps
patients.
and patients. Yes, yes.
Yep.
Um, but it can help address the need to kind of shortcut some of the step therapy protocols. So, for example, to try medication A for a while before you can move to medication B and have that approved by your insurance, or get that MRI or whatever. Guava can actually bring and ensure that you have all the documentation about, oh, actually, 2 years ago, you were on medication A for this time to this time, and it really didn't help. So, it is time to go to medication B in a way that is much harder for us as humans to all just remember that kind of information and really document it in a way that's helpful for getting that prior authorization for medication B, approved. So, from a chronic disease standpoint, it helps make sure that everybody's working with all of the information that's relevant. And that's so difficult because it's so fractured right now otherwise in so many different locations. And so this just is really dramatic in terms of what it can do and how it can help move things forward and really improve that communication between the patient and their physician, because there's clarity about what's known and what's not known.
And limited time, right? Like we talk a lot, that
Oh,
comes up a
yeah,
lot in this show.
absolutely.
You get 15 minutes with your
15
doctor,
minutes.
right? Because you've got
Yeah,
so many visits you need to have
right.
every day to keep your
Yep,
doors
yep.
open.
Absolutely. Well, it's for private practice docs, it's about keeping their doors open. For
Right.
larger organizations, it's whatever's been packed into schedule. Lots and lots of doctors have they're double, triple booked, and frankly, they're doing work all evening long at home. They're coming home, feeding their kids, and then sitting down with their computer doing what we call pajama time, documenting. So,
Charting.
yeah, charting, absolutely. And
Yeah.
so what this does is lets you get to the heart of what you're trying to address in an appointment really
Hmm.
quickly to give you time to discuss what actually matters rather than it
Hmm.
just being all the information gathering.
Yeah, I always like to say like the technology and whatnot that we have in place today, and that's coming, it lets
Hmm.
doctors doctor. Lets you do what you want to
Yes.
do. That's what you're here
Right,
for. You're not
right.
here to do
Yes,
paperwork. You're
absolutely.
here to take care of
Oh, and
your,
we do so much of it.
yeah,
Yeah,
yeah.
yeah, yeah. And we do so much of it. And frankly, we don't have the time to be reviewing through lots and lots of old records trying to get clues. So things like Guava that can help pull together all of the salient points from a record are just tremendous. That Guava has a keyword search component to it. So, having a discussion and your doctor says, "Well, I'm thinking about your thyroid." You can pull up every instance that every doctor has ever uttered the word thyroid in your medical record in just a moment, um,
Wow.
in your Guava record through that keyword search, which is, that's just amazing. And that just doesn't exist in our electronic medical records. You'd think it would. It exists in, Microsoft Word, right? But not in the EMR.
So, I mean, it sound this is like a great solve to a big problem, but I'm actually curious what the root of the problem is. Why wasn't what was standing in the way of there being a system for the medical records to be accessible like that in general before you guys came around? Was it the law, or is it just the fragmented
Yeah.
system that we have for healthcare? Is it the
It's kind of, well,
privatization of healthcare?
all of the above.
Hmm.
So there was uh, some legislation that went into effect a bunch of years ago called meaningful use, which really encouraged clinicians to go to an electronic medical record. And it started by providing them carrots, and rewards for doing it, and eventually finished up with sticks or, decreased reimbursement if you're not using an electronic medical record. And it was kind of a race, and there were lots and lots of different software companies trying to get in there and get a piece of that pie. And so, and none of them talked to each other. So we got all these disparate records. And at one point, there was some discussion of maybe the record that the VA was using should just be nationalized, but that didn't actually ever get legs. So we have lots and lots of different software companies under no pressure to talk to each other, all competitors with each other, not interested in really making those all connect. And then we have healthcare providers that are in very different situations. Some of them are self-employed and kind of that old style of, a small business, run my own office. It's me and maybe one
Still
or two
using
other
paper.
providers. Well,
Yep.
not anymore. Not
Not
anymore.
anymore.
Not if they're billing. Nope, no, because you can't.
Right.
But at least not for for physician visits that you're going to be billing insurance and Medicare, Medicaid anyway. Um, but there also are these instances of so many physicians are employed by large organizations, and so there are many different kinds of doctors' offices. There's not just one flavor, and so everyone does their work a little bit differently, and so that also made it really be fractured. And then one of the things that changed is there was some legislation that said that all the electronic medical records really have to have patient portals and they need to be open and available. And that really made a difference for solutions, because then it became clear that patients had not just a right to their record, but a right to their record in real time and a means to be able to get it. And so Guava is able to take that kind of access and with your permission and allowing Guava to have this role for you, be able to access that information.
So they realized the problem. They didn't solve it, but they opened it up so someone else could, basically.
Correct. Yeah,
All right. Well,
essentially.
good job stepping in and getting the solve done. Thank you. I appreciate that.
Yeah, yeah.
Well, at least they moved in the right direction there, though, right? They're not keeping you from doing it anymore.
Right.
So,
Oh, yeah, right. And in fact, if there are systems that are, or clinician, electronic medical records that are not allowing patients to have access, it's actually called information blocking, and there are penalties for that now too.
cool.
Well,
Cool.
good to know that's happening.
Yeah, it is actually because I
Yeah,
mean, it
yeah.
sounds like you used to not even be able to come up with a solve for it. There just wasn't even a place for it.
No, there
So
really
at least
wasn't.
we've made that progress.
Right. And, it's taken a little bit of a shift of perspective too, because it's also taken a shift within the healthcare industry to recognize that the medical record actually is the patient's. It's not the hospitals, and the hospital and that hospital system might be the physical owners of the electrons that are like putting that together, but the information is all the patients, and that they have a right to that. And whether it's the note that I'm writing about them, having seen them, and I'm writing what our plan is, or the results of the CT scan that was done on their hip or whatever. The recognition of that information actually belongs to the patient has taken some time to really shift, but we're here.
So Guava Health is solving that problem, which is amazing.
Mm,
But then, which is right, that's like huge, huge part of why Guava Health
yeah.
exists. But then the other huge, huge part of it is that kind of clinical piece. It's that
Hmm.
healthcare or that health condition management
Yeah.
aspect of it. And I know I mentioned earlier on in our conversation, where Guava Health certainly serves people who have chronic health conditions or
Right.
multiple symptoms, things that are a little bit more significant, less than like somebody who might not really have anything going on. It might not be as beneficial, right? I mean, not that it wouldn't
Hmm.
be, but it certainly would help somebody more. So, from your perspective, as being, a physician, coming from the clinician's perspective, being the
Hmm.
CMO, how do you
Yep.
see Guava serving those types of people in a more meaningful way that makes their journey a little bit, hopefully a little bit more easier anyhow?
Yeah, yeah. Well, let me before I say that, let me just say that, tell me one person who doesn't want to improve their health. I mean, really, even if you're healthy and really don't even
Right.
take any meds or anything, you still want to be healthy and continue.
Hmm.
So there are many, many ways in which guava can actually work really well for you as well. But it is a particularly useful tool for people who have a chronic disease. So, one of the things with chronic disease is that there's a lot of keeping track of things. So, keeping track of medications you need to take, refills that you need to manage, healthcare visits, labs, improvement or lack of improvement, and then all of those, keeping track of all of that in your day-to-day life, and also then thinking about what are the things that are impacting your health. So some days are better, some days are worse. Why? What is making you have a more tired day? And is it because you walked more steps, or is it because you got more sleep, or didn't get as much sleep, or the air pressure, or whatever that might be? And so being able to track all of that information is really, really important. And in doing it in the context of all your medical data as well is really, really helpful. So keeping tabs on the things that you're supposed to be keeping track of, and also noticing what's going on with your life. So some people are tracking a lot of symptoms, and they're doing so to try to hone in on more a tighter diagnosis, or the utility of a certain medication, for example, or to notice if a certain medication is really helping or not. Sometimes that can be a little bit difficult to discern, and so by being able to use guava to be able to track your day-to-day experience of your disease is really, really helpful, because then guava actually can help you understand, is this helping or is this not? There is a feature called Insights that really looks at what are the statistically significant correlations between things. So it's not specifically cause and effect, and it's not random. And it's the things that are statistically significantly correlated. And so it can help you understand that if that this actually, since you've been taking this new med, you've actually been much more tired in a way that's actually meaningful. And that there's some data behind it to help bolster that perspective. And it may make you have a discussion with your provider about, can we change this dose, because this new dose on this medication, or this new medication is I'm struggling with it. Can we change the dose and see if that works a little bit better? and you have that information of it being related, correlated with the start of that medication because of your guava record. So, that's not, we're really bad at remembering things. Was it last Tuesday that I had the headache, or was it Friday? You don't remember this. We think we're great, we're terrible. Um, and so using guava to help track the components of your chronic disease really helps, because it puts a pin in the places of where things are going on, and then is able to look at it from an analytical standpoint as well, to give you information to make changes with.
As you were talking to, and I'm going back to the comment of like people who maybe are healthier or think they are. So I'm going to
Sure.
use myself as an example here. So where I could see Guava Health would be great for, could be for anyone, because sometimes you don't know how bad you're feeling until you feel better.
Mm,
So
right.
I had started perimenopause a few years
Mm-hmm.
ago, and I didn't
Mm-hmm.
know what was going on. I thought, well, I'm only
Mm-hmm.
44 at the time, and that
Right.
seemed a little early. And I was having all these symptoms. And of course, our moms and grandmas never talked about menopause. Now it's
Right.
like everyone's
Yeah.
screaming up from the
Right.
mountaintops, which I love,
It's the new diet, right?
myself included. But I didn't realize until I went on hormone therapy about a year and a half ago, that I felt terrible. Like I
Mm.
was,
Mm-hmm.
I was spiraling bad. Like I was
Mm.
not in a good place. And you
Mm-hmm.
become, sometimes you just become complacent, or you're just
Sure.
like, this is just normal and this is just who I am now. And I'm just getting
Yeah.
older. And you don't think about like how crappy you actually feel. And then
Yeah.
as soon as I got on HRT and got my estrogen back up to where it should be, it was like a night and day change. And I was like,
Sure.
wow, I was in
Yeah.
bad shape. So,
Yeah, yeah.
I could
You
see
lose track of
there,
your baseline. Yeah,
yeah,
you lose track of that
exactly.
baseline. Right. And if you
Exactly.
had been tracking what your energy level was prior to
Hmm.
all that, like, oh, my energy level is a 7 or an 8 or a 6 or a 7.
Yeah.
And, throughout the days, and oh, here's a 10 day or whatever. And then start to notice that, oh, it's a 3 and a 4 and a,
Hmm.
5 and a 3. You'd be able to see that trend over time of, oh, wait a minute, something actually is going on here.
Yeah.
Yeah.
It's preventative.
Yeah, and the real problem is if you're at seven long enough, it starts feeling like four. And your four is your new four is your old seven, and then you work your way back up to seven. You know what I mean? Like you just get used to it.
Yep.
You get
Right. It
used to
is
the
true.
pain,
It
you
is
get
true.
used to the symptoms, and they
Yeah.
just become the baseline, I guess, is what it is, right?
Yeah.
Well, yes and no. I'd say it doesn't have to be that way, and that's where the being able to track interventions and what makes a difference and what doesn't make a difference really is helpful.
Yeah.
Uh,
Right,
yeah,
right.
for the chronic disease management. Yeah. It's
So,
there's just chronic disease management it can be a full-time job. You
mhm.
have, diabetes, you have to worry about what your A1C is and what your glucose is now and what your insulin regimen is and, how many carbohydrates you're eating and, are you exercising or you're not exercising and what do you have to change related to that? And did you get your eye exam and are you looking at your feet and all of these different things? It's a full-time job, right? And that's for somebody who's fairly healthy with their diabetes. When you get into folks whose diabetes is kind of spiraled out of control, it's even more difficult. So, any of the kinds of tools that can pull together all of the things that you need to do it and really help you manage it all in a single location is just really tremendous. We've spent a lot of time working with a lot of different chronic disease entities to try to make sure that Guava really is going to be the answer that they need for tracking things. So, we know that folks, for example, we have a lot of users who have POTS, and
Oh,
one
okay.
of the things that they track is really their water intake. And so, we have the NFC tags that allow you to not have to worry about trying to type in exactly every time you fill your water bottle. You can just, put a little tag on your water bottle, and every time you fill it up, you just wave your phone in front of it, and boom, you can record, filled my water bottle again. And
Huh.
so we really are looking at what are the ways that we can really make managing a disease and doing the things that you need to be doing as easy as possible. One of the things that uh, it is can be really annoying if you track anything is having to type everything in and select from the menu and put all that in there. And so one of the things we've worked on is having voice logging, so you can just touch it and say, I drank another bottle of water and three coffees, and have that logged for today. And it's just a lot more straightforward. So you can just keep living your life instead of spending your whole life managing the components to your healthcare.
Yeah. And it's not only is it good for the patient, it's beneficial for the provider. Like as you were
Oh,
saying,
yes.
talk about teeing up all this information, rather than having to try to recollect all of the things that, have happened when you go in there,
Right.
you're like, here it is. And so it actually, how does that work? So I have the Guava Health app, let's just say, right?
Hmm. Yeah,
Um,
yeah.
and I have some, okay, because I always talk about me being in perimenopause because I have no shame.
As you should.
No, I don't care. I mean, it's part of life, right?
Right,
I am
exactly.
going through perimenopause, people. Like, let it be known. So, and there's a lot of really terrible things that I feel some days, right? So, if I'm tracking in Guava, right? How do I
Hmm.
get that to my doctor when I go in? Am I able to send that to my doctor beforehand? Do they have to be part of a network? Do I walk in and say, "Hey, it's just all right here in the app"? How does that
So,
work?
well, there are a variety of ways you can do that. So, first of all, you can pull it all together and just use it as a cheat sheet for yourself if you want.
Hmm.
I mean, that's really straightforward, right? Put it all together. You have that. You can talk from that. That's the notes that you're using to have it all organized for that visit. You also can make a PDF and print it out. You can give it to them. They can then scan that into their record as well. We don't have a way yet to get it put directly into the medical record. Everybody's medical record is proprietarily theirs, but we're working on different ways to work on that process as well. So there are a variety of ways that you can do it. But the point really is to ensure that the the provider really can see that breadth of information. So, for example, if you have lab work and it's done at a few different places, one of the things that Guava can do is it can graph out how that lab work is progressing um, over time sequence, not separate from one place to another. So, like you can have a graph, a line graph that says, "Oh, look at my creatinine is improving over these past 3 months. These, even though I got my lab work done in three different places." So, that being able to show that to a clinician, picture tells a thousand words, right? So, having the access to be able to do that in a way that would otherwise be completely unavailable is really helpful.
Hmm. That's really cool. So I'm assuming, I mean, this technology, does AI play a pretty big role in how Guava works, or is it really more of being this kind of central? AI comes up like every interview that we do, so I figure I might as well
Everywhere.
mention it. Is that a part of it? Is it more just kind of being this kind of, I don't know, I feel like this nucleus, is that the right word? That Guava kind of
Right.
sits at the middle and kind of pulls from everywhere.
Yes, yes, and yes. So Guava it really is that hub that is pulling
Yep.
all the information in for sure, and not just from your medical record, but from your Apple Watch and your Fitbit and your Aura Ring and your Dexcom blood glucose monitor, your smart scale, your smart blood pressure cuff, all of that. So it really is the hub from all of those different kinds of devices as well as your medical record. But yes, we do use AI in this in that for example, when I talked about setting up that visit prep, so we Guava pulls the information that's relevant from your medical history about the medications you're taking for that particular, when I said, you're going to go to the neurologist for a headache, for example, it'll pull in what are the relevant diagnoses you've had, relevant visits, and some of that history from your notes. So that, we do use some of that. We have what's called a Guava assistant who helps pull some of that together for you so that you don't have to search through saying, I remember I got something somewhere. That's useless. Forget that. That's not going to be helpful. What's helpful is Guava being able to serve that up for you.
Got it. And in terms of, coming from your perspective again, like as a
Hmm.
hospitalist, the kind of the clinician, the provider point of view,
Yeah.
And I mean, obviously you believe in Guava, you're their now their chief medical
Yeah.
officer, which
Yeah.
is really amazing. Um, how aside from managing, right? Like
Hmm.
using the app to manage your conditions, being more prepared to when you go in to meet with your doctor,
Right.
what have you seen or what are you hearing from the users of Guava
Hmm.
so far? Like what is improving for them? Are they getting better? Is it helping them get
Hmm.
better? Is it I'd love to hear a little bit about maybe kind of some member success stories, nothing
Sure.
specific, but yeah,
Yeah. Yeah. Well, one example that I can tell you is, it's helping people get their information faster and more reliably. So, one small little story I have is a friend of mine actually had been feeling terrible and, had a cough and fever and congestion and was worried that maybe she was getting a pneumonia. She went in to go see her provider. They wanted to get an x-ray. That sounds great, but it was Friday on a holiday weekend. And so, I said, well, how, what came of it? How does it look? And she said, well, I don't know. They didn't call me back yet. And it's Friday on a holiday weekend. I'm probably not going to know whether I need antibiotics or not till Tuesday. And I said, did you check Guava? And she's like, oh yeah. And she was able to go online, or, go open up her app and boom, the report is there, no pneumonia. And she's like, oh my God, I can't even believe it. So, just peace of mind of being able to have all that information just really right at
that's
hand
cool.
is super cool. I think that we do see folks really appreciating the medication reminders and being able to log that their medications are being taken. And, actually, you can also co-manage a profile with somebody, so you can have some access. So being able to have access to see that your parent is documenting that they've taken their meds for folks who are helping manage elders. That's a big relief of worry for sure. And then I think it's really I, I think that we're finding that folks are really they feel heard in their provider's office when they can come to the table with all of this information at their fingertips, really cogently pulled together, and they feel more pulled together and they feel more heard by their clinicians about what's working or what's not working or what the concerns are. And that just goes a long way to actually getting to the root of whatever a diagnosis is, and figuring out the way to manage it. Um, yeah, it's been tremendous. Another thing is folks who travel a lot. I know that there's some real peace of mind that a friend of mine is travels a lot nationally for various presentations, and she knows that she always has her entire medical record with her. And should she need to go to an emergency department in some other state, it's fine. She's got it all with her. And so I think that that's also just that peace of mind of knowing that you have that, and in any care situation, it'll be your care can be delivered with knowledge as opposed to blindly. And as a clinician, I'll just tell you, I wish I had all of that information on all of my patients. Mostly I don't, right? And so mostly I'm winging it, and nobody wants to hear that, but it's true. That people will say, well, I take, that purple pill and then that long skinny one my daughter-in-law gives me, but I only actually take half of it. She thinks I take the whole thing. And I'm trying to figure out how I'm treating their hypertension or their heart failure or whatever it is they're in the hospital with that kind of information. That's not that helpful. So
How honest are they being? Because we know people aren't honest when doctors ask them questions. They just
it's totally true. It's totally
it's
true. Yeah.
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 So I don't know. Something like this to me, you think, and especially in healthcare, two of the
Hmm.
biggest things is access and empowerment, and Guava Health
Hmm.
is definitely solving for that, like access to
Yeah.
information. So like knowledge is
Yeah.
power, but the empowerment part of it is so huge. Like to be like a patient and not know, where your medical records are, how to access
Right.
them. Just
Right.
even thinking about that right now, like I I don't know. I have to dig through email, call
Yeah.
doctors that I've seen,
Yeah.
years
Yeah.
ago
Yeah.
because like I have like a thyroid thing, and so Yeah, I wouldn't, it would take me too long to even figure it out
Right, right.
that I
Yeah,
may not do it, right? Like
right.
I
Yeah,
literally might just not do
yeah.
anything, which is not a good, that's not a good thing.
So
Not helpful.
if in a case like that, if she signed up for Guava, would it
Mhm.
go out and find all those records on its own, or would she still have to find them initially?
So you own the access to all of your medical records, and so Guava would assist you in explaining how you need to do that. But it's really what we do is we pull things through patient portals, and so regardless of whether or not you are aware that you have patient portals, you do have access to patient portals in all of the locations you've got in healthcare. So it's really just walking you through that process, and then you can add devices as well. So we don't know which Apple Watch is yours. We don't know, which, Julie Smith you are at Sutter Health. So, you're involved in that process. Plus, it's secure and HIPAA compliant, and by definition, that means that you are the one who needs to grant access and say that
Mm.
it's okay. So you're involved in that process.
Yeah.
That's cool. That really is cool.
Just thinking about that, like being able to see everything in one place is it's
Mm.
mind-blowing to me.
Mhm.
Like,
Yes.
why was this not a thing before? You
Yeah.
Because
know?
we don't have
Yeah.
socialized medicine.
Yeah,
Right.
well,
It's
That's a
true.
different conversation.
It's true. It's true. There are other countries that have a more organized health record in that way. Yeah.
mm,
Yeah.
it's pretty crazy that we're just now really solving for it
Hmm.
and yeah, Guava Health is here to do it.
Yeah.
So,
Yeah.
yeah.
And the fact that it's pulling together not just that stagnant data or that point in time data, but also um, allowing you to interact with it through documenting what's going on with your health in the process of that. So, for example, I have there's another patient I can think of who was really struggling with their ADHD and trying to get the medications, just dosed correctly for what they needed to do. And it was really hard to sort out, as you can imagine, with that diagnosis. It was really hard for them to be able to sort out what was the right dose for them to make them really feel the best and be the most functional. And it really was through just documenting what they felt like at each day in the Guava record that helped them really hone in on what that right dose was. And all of the access to all the medical records in the world aren't going to do that. It's really integrating that information with the ability to put your own input into your record that's going to really provide that opportunity to hone in on some of those things.
It's just made me think about something when you mentioned ADHD. I think of kids immediately. Um,
Mm-hmm.
as a it- as a parent, right? If I have a
Mm-hmm.
child with a,
Yeah.
severe chronic condition,
Yeah.
how does that work with Guava? Can you set it up for your kids so that you have access
Yes.
to it? I know you had said
Yes.
you can like have
Yeah.
like partners or whatever, but
Yes.
is that
Yes.
similar?
We have a family plan actually that
Oh,
lets you do exactly that. And really, for if you have a child who sees a number of different specialists, that's very fractured in terms of that data. Chances are you may travel someplace for getting care. So it can be really, really fractured. And, frankly, if you have a kid who is basically healthy, you still need to keep track of, what their vaccination is. Are they growing properly? Do you need to worry about that? We have some resources available through GovOf, like your growth percentile calculator, so you can take a look at where your child is on some of these charts and feel more comfortable about their development as well. But you still need to have the sports physical and the vaccination schedules and documentation, and that's a lot to keep track of. And for you have three kids, you have three sets of all of that, and having a family eye on where your kids are is really helpful
Well,
for sure.
and also just kind of being ready for the unexpected because like we've done
Mm,
a couple of really great interviews as part of our Human Stories series, and a lot of it was around like these kind of acute care situations where like you went from like normal to like we don't know what the hell's going on anymore with me or
hmm.
my spouse or whoever. So and then you're just kind of spinning, right? At that point,
Right.
trying to figure out what's wrong. I'm thinking of Stacy Mead.
Oh yeah.
Yeah, and her husband's medical condition that kind of came out of the blue, right?
Mhm.
So where it is kind of aligned to this concept of like preventative care, right? Like kind of being prepared
Mhm.
for what might happen,
Mhm.
and
Mhm.
having these baselines, having kind of everything in the place before the crazy happens, right? Because it's something that's going to
Right.
happen, right? Like we can't avoid it. We're all going to run into some kind of unexpected, stressful medical healthcare situation at some point, whether it's you or the people you care for. So,
Right. Absolutely. I mean, folks of a certain age are managing their parents' health and their kids' health at the same time.
hmm
And, being able to have eyes on that and have the information available for, at your fingertips is huge.
yeah, what a great tool for that.
Yeah.
I'm now thinking, I should be using Guava.
Yeah.
Yeah.
The longer this conversation goes, the more Heather's getting talked into something here.
It's not hard, honestly. I think about, well,
Yeah.
I literally been thinking about my own family, my own health, right?
Yeah.
And the
Right.
fact that, I am married and my husband doesn't do anything for his health care. So of course I'm gonna have to be the one. Sorry, Jeremy, but dudes aren't the greatest about
Right. Right.
taking care
Right.
of their health.
Right.
I
So,
go to the doctor once every 10 years for a tetanus shot.
well, at least you're healthy.
There you go.
Yeah,
Do you
it's
know
because I
when your
walk
10
around
years is
barefoot.
up?
He does.
Do you know when
But
your 10 years is up?
Uh, yeah, I'm turning 50 in October. I got to get it by then because I always try to get it right around my birthday. That way I remember. I got it when I turned 40. I'll get it when I turn 50. Yep.
good
If
planning.
yep.
Good play. But
All
it is,
right.
I mean, I can see this like where it would be such a wonderful tool with, and I have two kids. My oldest just
Mm-hmm.
started driving. He literally drove to school for the first time this
Yeah.
morning.
Yeah.
Oh no,
Well,
really?
wow,
So
that's a big deal.
yeah,
So let me,
little
Glad I
trip.
wasn't
right.
driving this morning.
So so your kids just turned 15 or 16, right? And they
16,
got
yeah.
a couple more years that they're at home and then they're off into the world. And
Right.
they're, if they're going away to school, they're not going to be seeing their pediatrician anymore. And even they're just going to age out of their pediatrician, right? So they're going to need to see some other provider, whether it's, if they're going off to college, it's going to be the campus health center, or if they're just, finding a primary care provider who they've never met before. In both instances, having their pediatric record available for them, which has all of their vaccination information and any other kinds of health problems they've had and what other medications they've had over the history of their growing up, having that available in that new setting for them is huge, and
Yeah.
it really, can really knit together and make that transition into adulthood a little bit smoother.
Oh, yes. And that empowerment right there, right? Like we've
Yep.
got to really arm these
Yeah.
kids with information and
Yeah.
the empowerment to take care of themselves, right? Like I always
Right.
say to my kids, I want you to go out into the world capable of taking care of yourself. And that doesn't just mean doing your laundry, you know?
Right.
It's,
Right.
it's bigger than that. And it is about
Right.
health, right? And
Yeah.
and knowing where you can go for care and knowing about your history of your health. So, yeah,
Right.
that's a
Right.
really good point. So,
Yeah. And
Yeah.
they may want to go to Florida for spring break or do a semester abroad, and you gotta be prepared for those instances as well. So.
And especially for this next generation who's so used to having everything on their phone and everything's
Hmm.
technologized and they need a
Yeah.
password to do anything kind of like having having that app would be almost just a natural thing for them, I
Right.
would think.
Yeah.
Like this is
Yeah.
how we track our healthcare.
yeah.
Yeah.
It's,
Right.
it's
Well, and
very straightforward for them as opposed to the older
yeah.
generations.
Right. And then they're much more used to the idea that things about them wrap around them. Nothing about me without me, kind of a concept. And so, really, Guava allows that to be true in the healthcare world in a way that otherwise it isn't true.
Oh, that's a really good point. Yeah.
Yeah.
Yeah, the Gen Z
Hmm.
and Gen Alpha. So
Yes, we're
I
now
have an
to Gen
11,
Alpha,
yeah, I have an
right?
11-year-old and the 16-year-old. So yeah, like that's how they think because
Yeah.
we didn't all grow up in, it's like that whole analog to digital Gen X
Mm-hmm.
kind of,
Mm-hmm.
Oh, it's a different
Mm-hmm.
world. It's a
Mm-hmm.
totally different world that they're growing up in.
right?
Yeah.
My mom, the silent generation, she's going to be 83. I mean,
Yeah.
I don't know that she would
Yeah.
use the Guava Health app without my help, but like case in point, like I'm a sandwich
Yep.
generation. Not only do I
Yep.
take care of my mom to a certain degree, she's pretty healthy, thankfully, but got kids. I got a
Right.
husband who, wouldn't
Yeah.
even know how to call the doctor. So let's be honest.
We already
Sorry, Jake.
discussed men don't call doctors
Yeah.
Until it's really bad.
until we really, really need to.
Right,
A walk
exactly.
in
Yeah.
bleeding. Ah!
Yeah.
With duct tape.
Oh yeah.
Yeah.
I've definitely shown up at the ER with duct tape on. No doubt.
Yeah.
Well, I don't know. I'm pretty blown away. I mean, we got to meet with Isabel in the first part of
Hmm.
this Guava Health series, and getting your perspective, that this more kind of clinical perspective, and
Yeah.
the real I think like immediate benefits, and like how it really changes the way that we kind of exist in the healthcare ecosystem,
Hmm.
is just it's crazy. So like Guava Health, it wouldn't surprise me if you guys just start like taking off like crazy here once more and more people know about it and start using it. So,
Right. Yeah, yeah, yeah. Well, we're in this for the long haul. We really, want it, and as I think probably Isabel mentioned, our baseline product is free. It's available on all the app stores. There are more bells and whistles for a subscription model, and I think they're worth it. But either way, it's not an expensive upgrade, even that. But the information is yours and out there, and so we want you to have that. And whether you're managing a chronic disease and need that assistance, or would just welcome that assistance, or whether you're very healthy and thinking about longevity, and how do I positively live my longest, happiest, healthiest life. Either way, Guava is really an excellent tool for helping you do that. And helping people get to diagnosis more quickly, helping folks feel heard and by their clinicians, heard and seen, is just really super important. And we know as a population, as we're living longer and longer, we're managing more chronic diseases. And so having really effective tools to do that makes a tremendous amount of sense. And then, as I said, lastly, the fact that without something like Guava, we're not actually the center of all of our health related information. But having Guava kind of turns that whole thing inside out so that you are the center of everything about you related to your health. And that's just that it's really revolutionary. And just a tremendous tool in that way. So I love it. I think it's great.
I
I think it's where we're going.
I didn't think it could get any better. And then she said it was free.
I know.
Yeah,
Like,
Yeah.
the
what?
base model is free. Yeah, go on, leave us a great review, but go on the app stores. We're there and available, and yeah, check it out.
I'm going to try it just to see if it can actually track my randomness of health records throughout the country down because I've moved long distance and I go so seldom
Yeah,
and every time I go it's someone different. I
yeah,
might download it
yeah.
just to test it and see how well it works.
You
Yeah.
do that. Go right
Report
ahead.
back to
And
you on that.
yeah, yeah.
Just show you all your
And the other
tetanus
thing
shots that you've gotten.
Yeah, like I am a shots guy. I do want to keep up with my vaccines and stuff. That's
excellent.
the one thing I
Yeah,
really do
yeah,
want to do. So I
yeah.
might actually need more shots that I'm not even aware of. So I'm seriously
It's
going to download
possible.
that and see what it says.
Possible. Got
Yeah.
to consider
Guava might tell
measles,
you.
right?
Yeah,
Um,
we
Right.
measles, no
There's an
kidding.
outbreak in
right.
Texas right now. We're in Arizona. Like
Exactly.
that's a real thing.
Exactly.
Yeah.
Right. And, depending on your age, you maybe did or didn't get a full round of that vaccination when you were a child. There's a certain set of years where folks
Oh,
need a booster. So if you look in your guava, you can figure that out.
Oh
look
man,
at
I'm so gonna download this now.
see, there you
I'm
go.
like
The
the
other
last
thing I
person I would think would do that. And now I'm like, oh
yeah.
my God, I need to download this.
There you go.
That's
One other thing
awesome.
I want to mention is if you go to guavahealth.com, there's also a lot of resources that we have available on that site. We have, a lot of articles about healthcare in ways in which folks are using Guava, ways in which it can be helpful, and also just some of the diagnoses that are difficult to understand. We also have started putting in some tools, so there's some calculators in there that have been very helpful for folks. So there's some things to explore if you like on that site as well.
Great.
Heather's literally looking at your website right
I
now.
am. Yeah, I've had it up the whole time. Um, no, it's great. And I was gonna, ask you, where can we find you as we wrap up this amazing conversation? But you've already shared that, so we know we've
There you
got
go.
the app. Just go
Yep,
go wherever you download apps,
absolutely.
right?
Yep. Just go
Find the
to,
Guava
your
app.
app stores. Yep.
Yeah,
And or just go
perfect.
online to guavahealth.com
Yeah,
and leave us great
guavahealth.com.
reviews.
yeah, absolutely. We
Awesome.
we know how reviews are. Got to have those. Well, this has been a really great conversation. I'm so glad that we brought you back or brought you on as part of our part two, so we can really get a really deeper understanding about what Guava Health is doing. So
Yeah, this really is a major
exciting stuff.
development for people, I feel.
Yeah. Well,
Yeah. Well, we're really just trying to move the healthcare equation forward with patients really at the center of that. Yeah.
Awesome.
absolutely. Well, you're doing it. So bravo.
Great. Well, thank you for taking the time to chat with us. I think
Yeah.
it's great
Thanks for
to
coming on. This has
be able
been
to
a
have the
great,
discussion.
yeah, this has been a great chat.
And there you go, our conversation with Dr. Kat from Guava Health to round out the Guava two-parter. Yeah, truly amazing stuff. I can't stop talking about what a great product they have here. But what are our main takeaways from all this, Heather?
Truly, I think it's exactly what you've been kind of, falling out your seat from.
I'm so impressed by this, honestly. I really
Yeah,
am.
it's solving for literally one of the biggest issues in the healthcare industry, which is this whole thing around medical records and having disjointed, disconnected systems of, that hold our medical records as patients, as people, and they don't, and the systems don't talk to one another. I mean, it's kind of wild to think that in 2025, you're going to walk into your doctor's office and they're still not going to have access to all of your medical records over, however many doctors or hospitals or facilities that you've visited because they just don't have access to it. And so Guava Health is like literally the first product, right? Technology that has ever solved for this issue. And having access to information is one of the most important things in healthcare. And when you don't have that, it impedes efficiency, it impedes knowledge, it impedes conversations that you have, again, that 15 minutes that you might
Yeah.
get with your doctor. And
You got to know
so,
how to use that time right. You have so little of it.
yeah. So it's just it is revolutionary as Kat said. So,
Really is. Yeah. Really is. And you did mention, I do want to drop in there for people. You mentioned Stacy Mead in the episode
I
there.
did.
She is the bonus episode between episodes 12 and 13, if anybody wants to go back and check that out.
Yeah,
She
that's
had quite a story, man.
right. Like think about, I mean, Guava Health could have certainly helped in that situation, but
Yeah.
and that's about being, more kind of proactive and planned for the unexpected, because it is definitely geared and will serve people with chronic or like, uh, shoot, what's the word? Where you have multiple conditions
Oh, yeah.
that are dependent on one another. And I'm totally
Right.
blanking on this word right now, but anyway, chronic conditions in general, like
And
it's
having to see six different specialists and stuff. Yeah.
yeah, I mean that's important for them, but also like for a family like mine, right? Like we've got some things going on, nothing major. We don't have anyone that has any like major medical issues, but it's still a great place for us to start pulling all of our healthcare data together, tracking everything, and then being prepared for when inevitably something will happen.
Yeah.
Getting ahead of things before you're in kind of the throes of chaos and overwhelm
Right.
is always something that I think should be a priority.
Yeah. And it might be the only product we've covered so far that is truly for everyone.
Yeah.
It doesn't have a niche. It doesn't deal with a specific issue. It deals with the fact that we all need to take control of our own health records.
Yep.
Like, I'm going to download this app.
Yeah. It's
I
such a
talk all the
simple
time
thing.
about how I don't go to the doctor. I'm going to download this app to see if because I got to go for that tetanus shot soon. I'm going to see if I need any other updates on my vaccinations and stuff.
Yeah.
and
Yeah.
it's going to tell me. And like, I haven't seen my own medical records ever.
That's kind of
Like
scary, Jeremy.
if I can really download an app and instantly have access to all my medical records,
Yeah.
like,
Or at least have a guide, right? Uh,
yeah,
Like a
like if it actually has dates of all the shots that I've had in my life, and I can
right.
actually, like, I never thought I would have access to that
Yeah.
information. I just thought I had to
Yeah.
figure it out as I went.
Knowledge is power.
And knowing is half the battle.
Yes, it is.
Wise
Oh,
man once said.
He-Man
G.I. Joe, thank
or
you.
G.I. Joe. Sorry. Wrong 80s cartoon. My bad.
That's all right. The guys know that a little better, I think.
Yeah. Real American hero.
Yeah, yeah. Knowing is half the. The more you know.
Yeah, there's
Like
also
we
that.
grew up hearing things like that all the time. So yeah, know your own history, know your own health, man.
And that's what we're all about here on
Yeah,
the Healthcare Uprising podcast is
yeah.
knowledge.
And also make sure to hit all those happy little fun buttons on whatever platform you're on, your likes and your subscribes and your shares. Share it with a friend who, because share it with all your friends on this one, because everyone needs this. We are on YouTube, so you can see us video. We're on all the major listening platforms, so you can listen to us on audio. Um, we have a Patreon, patreon.com/healthcare uprising, if you want to full on join up and throw a little money our way. What else should we tell them here, Heather?
Well, we have a website. It's healthcareuprising.com in development, but definitely bookmark
You
that.
can listen to us straight through the website.
You sure can. It'll get you where you need to go. And we're on all of the social media platforms. So LinkedIn, Facebook, Instagram, and Blue Sky. So we're posting out there a lot. Keep an eye out there. You'll know when our latest episodes are dropping. So follow, like all the things. And then also, if you have a story, are you a founder? Are you working for a company that's doing something really cool in the healthcare industry that's innovative and forward thinking? We'd love to talk to you. So shoot us an email, healthcareuprising@gmail.com, and reach out, and we'd love to meet with you and get you on the show. But also, if you're just a regular old human out there, and we know there's a lot of you, you've probably got a healthcare story to tell.
There's like 8 billion of us.
A whole bunch. So if you've got a story, good, bad, ugly, otherwise, all the things in between, we want to hear from you. We'd love to bring you on the show and share your story with us. The human stories are a really important part of what we do here. And yeah, so email us again at healthcareuprising@gmail.com. And with that, that is it for today. That is your dose of healthcare for the Healthcare Uprising podcast. So with that, keep looking for the good in the world because sometimes it's where you least expect it.
This has been a Shut Up production.